Hello everyone, this is Group 2 presenting the immunology workshop. The case scenario is Jack was rushed to hospital due to a traffic accident. Although his injury was not serious, but the doctor ordered him a blood transfusion. He was given ABRH positive blood based on the blood group card information. But Jack started to show hypertension and experienced difficulties in breathing after an hour of the blood transfusion. And the lab found out that Jack's blood group is B Rh positive and he had a bone marrow transplant 6 months ago based on his medical history. Based on the lab finding above, the hypothesis our group make is Jack is suffering from the ABO incompatibility reaction due to the wrong blood type transfusion.
What is genotype? Genotype is a genetic makeup of an organism that determines certain characteristics. There are three codominant alleles, IA, IB, and I, which determines the blood type of the person. 6 genotypes of blood includes AA, AO, BB, BO, AB, and OO. It is impossible to deduce the exact blood type solely based on genotypes. Then what is phenotype? Phenotype is an observable characteristic of an organism resulting from genotype. Phenotype of the blood group indicates which antigens are displayed on the surface of the red blood cell. 4 phenotypes of blood includes A, B, AB, and O. For instance, blood group A have genotype of AA or AO and presents A antigen on the red blood cell, while blood group O have genotype of OO and presents no antigen on the red blood cell. Some common situation when identification of blood phenotype is done is for identification of blood donor with unusual blood phenotype and for prevention of subsequent antibody formation by determining which antigen the patient lacks. What is rhesus positive and rhesus negative? Rhesus factor is an inheritable protein carried by the red blood cells. Either parents can inherit it to their child. If the Rh factor is expressed on the red blood cell, the person is Rh positive. But if the Rh factor is absent, the person is Rh negative. Overall, Jack's blood presents B antigen and Rh factor on the red blood cell. And the blood transfused to Jack presents both A and B antigens as well as the Rh factor.
Immune responses include antigen detecting as well as antigen processing. In blood transfusion, the red blood cells will be considered as foreign when they contain antigens that are absent in the patient. When the macrophage encounters an antigen, it will engulf and digest it, and the antigenic fragments will be presented on the cell surface together with MHC class II, known as major histocompatibility complex II. Interaction happens when a T helper cell binds to the antigen on the macrophage. The macrophage then secretes cytokines to stimulate the T cells, which in turn will secrete more cytokines to stimulate the growth of production of more T cells. The T helper cells, now activated, will leave to activate B cells. Besides the B cells were stimulated by the T cells to grow and divide, some may progress and mature into plasma cells that produce antibodies that are specific for the antigen that stimulate their production.
Moving on to the next slide, the third stages will be the immune system mounts a response to remove the antigen from the body. There are two main arms of immune response, which are humoral and cellular. Severe immune-mediated transfusion reactions usually involve the humoral immune response. When foreign red blood cells are introduced to a patient, the patient's pre-existing antibodies bind to the foreign antigen, coating the donor red blood cells. Some antibodies will activate the complement cascade, a series of enzyme-driven reactions involving protein fragments. The cascade ends with the formation of a membrane attack complex. The antibody simply binds to the donor red blood cells and causes them to clump together. The agglutinated cells may survive or may be removed from the circulation by the macrophages through phagocytosis. Thus, incompatible red blood cells are rapidly destroyed after antibody binding, results in hemolytic transfusion. Next, anaphylaxis is a life-threatening allergic reaction which can occur after blood transfusion when a patient's antibodies react with antigens in transfused blood components. It might also occur if an individual has previously been sensitized to an allergen present in the blood, and so when re-exposure producing IgG antibodies. Usually patients will develop symptoms such as difficulty in breathing, vomiting, and low blood pressure.
In Jack's case, his blood group is B positive, but he was given AB positive blood for blood transfusion. Jack's blood cells carry B antigens and antibodies against A antigen. AB positive blood has both A and B antigens. When the AB positive blood is introduced into his body, the A antigens will be attracted by plasma antibodies in Jack's blood, as the A antigens are served as foreign objects in Jack's body. This causes the lysis of the transfused blood. Eventually, ABO incompatibility can cause respiratory distress, hypotension, and hypothermia.
Due to ABO incompatibility, hemolytic transfusion reaction will occur where acute intravascular hemolysis of donorate blood cells will in turn cause further complications in the body, such as depletion of haptoglobins because all of the pre-existing haptoglobins have to bind to the excess hemoglobin in the blood, and some of the free residual hemoglobins will be converted to methemoglobin that imparts a reddish or brown color in the blood. Next, it could cause hemoglobinuria, where unbound hemoglobin dimers will accumulate in the kidney to be filtered out, and these heme pigments can cause acute injury to the kidney, either directly or by tubular obstruction or vasoconstriction. And next, it can also cause blood clotting, where the activation of cascades of immune system in your body can cause consumptive coagulation, and this results in the formation of a thrombus that can clot arteries and produce low blood pressure. And this can lead to many other conditions such as multiple organ failure whenever it clogs up a specific artery that leads to an organ, and even pulmonary embolism, which is why the patient might be suffering from difficulty of breathing.
And blood type change. In the cases of cancer or some diseases, hematopoietic stem cells known as HSC can be damaged or destroyed. Thus, bone marrow transplant is needed to replace the destroyed ones. As the HSC was received from donor, they produce specialized cells which include the RBC, red blood cells. In the bone marrow transplant, HLA, known as human leukocyte antigen, must match the donor, although the blood type does not necessarily be the same. This is due to the newly created red blood cells from the stem cells not obtaining the ABO antigens yet, but obtaining HLA. Therefore, in this case study, Jack was reported to receive a bone marrow transplant 6 months ago, and her original blood type may be type AB. As individuals with blood type AB, they are universal recipients and are able to receive any blood type, and in this case, the bone marrow transplant's donor blood type B. Thus, the new HSC donated from the blood donor, which is blood type B, could be the reason of Jack's change of blood type AB to B.
Our final hypothesis is Jackie is suffering from ABO incompatibility reaction due to wrong transfusion of blood type, and this is due to the change of blood group of the patient from blood type AB to blood type B after a previous bone marrow transplant. And this condition could have also been due to the negligence of the medical officer who's working in the hospital. So in conclusion, how do we stop this from happening again? So to avoid ABO incompatibility, we can use rapid diagnosis ABO test kits to determine the patient's blood type. And also, to make sure that the patient doesn't have any adverse reactions, you have to make sure that they're healthy, such as monitoring their vital signs such as temperature, heart rate, and blood pressure. That is all. Here are our references. And thanks for watching.